responsibilities as researchers now and for generations to come. So today, though, we're on the EDI webinar series. So we gather today during a time of significant societal debate about the role and value of the diversity initiatives. In these charged political climate, and I won't go into that much more, we're recognizing that meaningful research progress depends on diverse perspectives and experiences. And this is particularly important in women and children's health. As a research community, we therefore need to actively work to address longstanding inequities in who conducts research, whose questions are studied, and who benefits from scientific advancement. Through these sessions, we aim to provide practical strategies and thoughtful discussions that help us collectively build a more inclusive research ecosystem, not just because it's the right thing to do, but because diverse and equitable research environments produce better science that benefits everyone. So really appreciate everyone joining today, participating in this important conversation. And thank you to Bethan for organizing all this. I am pleased to serve as today's session moderator for the first one of these series, and I will be moderating the questions, and Dr. Willis will be taking questions at the end. And you can either use the chat function, but preferably raise your hand and let's have a conversation, a dialogue during the question and answer. But either way is fine, chat or raise your hand. So without further ado, I'm pleased to introduce our speaker, Dr. Lisa Willis. Dr. Willis received her BSc in biochemistry at the University of Victoria and her PhD in molecular and cellular biology from the University of Guelph. She did her postdoctoral fellowship at the University of Toronto, where she received the prestigious Banting Postdoctoral Fellowship Award. In 2019, she started as an assistant professor in the Department of Biological Sciences at the University of Alberta. So we're lucky to bring her back. She's been throughout Canada, and now we have her here, which is great, the U of A. And she's also an adjunct professor at the Department of Medical Microbiology and Immunology. In 2018, she founded InclusiveSTEM, a literature-based and data-driven framework for improving the participation and lived experiences of people from marginalized groups in STEM. So now I'll pass it off to, it says here, Dr. Willis, to Lisa, my friend, for you to educate us on what you can do to guide us in practical guidelines in biomedical research.
Awesome. Thank you so much, Sandy. Thank you to the organizers. Thank you to everyone for being here. This really is, as Sandy said, meant to be the starting place of a discussion, and we can talk about anything. We can talk about the ACB name change. We can talk about politics. I am open to any question that helps us achieve a collective understanding of one another and how to move forward in times that feel very trying, but are actually in many ways quite extraordinary in good ways. Not everything is bad. I'm a very positive person. I like practical strategies, which is why the title of this talk is Practical Strategies. I like thinking about things that each one of us as individuals can do and as us as collectives can do to make a real difference, to make things better for people. So I wanted to just to start off with talking about the proper language in Canada, because some people here are interested in EDIs, particularly for EDI statements and writing grant applications. And so I just wanted to start with the most boring slide to put us on the same page with regards to what we're talking about. There are 4 designated groups in the Employment Equity Act. These 4 here: women, persons with disabilities, Indigenous peoples, and racialized persons. So if you're writing EDI statements, then these are the terms you want to use. LGBTQ plus is not an official, or at least it wasn't, I think, actually maybe this year or last year, the Employment Equity Act was updated, or it's going to be updated to include members of the LGBTQ communities, but there are certain grant applications that do explicitly refer to these as a designated group as well. And so all of this is included in the proper language when we're talking about EDI in Canada. And then these are newer terms that some of you may have heard: EDI in research practice. This is how we actually carry out the research. And this is mostly what we'll talk about today. And then EDI in research design, this is thinking about the actual research project itself. And are we incorporating sex and gender-based analysis properly? That is in research design. Research practice is more about who's doing the work. And I think most people in this particular group know sex and gender, they're not the same thing. They influence one another, but they're not the same thing when it comes to writing EDI statements and that kind of thing. So I want to start with talking about some of the issues, and there are so many issues when you think about what's going on, but it's nice to just put us again on the same page. So I'm going to talk about women for a second, and I'm going to show you this data, which is from the 2017 report, NSERC's report on women in science and engineering. Data is a bit old. I'll show you updated data from Stats Canada in a second. What I want to show you here is this is a cohort of people who graduated grade 1. They enrolled in grade 1 in 1991, and then they followed these people throughout their career. So they graduated high school in 2003, did their bachelor's degree, master's, doctoral. And so the size of the bar is the number of people. And over here we have women, and over here we have men. And what you can see is we know that the population of Canada is about 50% women. And what you can see here is that only 41% of people graduating with a bachelor's degree are women in STEM in Canada. Only 37% of people graduating with a master's degree are women, and only 32% with a PhD. So we see higher attrition of women at every level up. The longer you stay in academia, the less women there are. And the same is true. This is not limited to academia. The same is true for government, for industry. There is fewer women the higher up you go. And what we know is that these numbers really have not changed all of that much. So from 2007 to 2014, there's no difference. There's no difference in the bachelor's, master's, or doctoral. This is enrollment. The only place where there was any substantial difference was in the mid-90s. There was an increase in the percentage of women enrolling in doctoral degrees. And then in the early 2000s, that cohort graduated. But again, it stagnated. So then if we look at some updated data, this is taken right from Stats Can from the 2021 census. Again, we can see that there's a bit of a stagnation. There's a little bit of movement maybe, but we're not on a really strong upward trajectory, with the exception perhaps of the PhDs. If we compare what's happening Canada-wide to what's happening here at the University of Alberta, what we're looking at here is the student EDI census report from 2021 to 2022. And if we're just looking at numbers, what we can see is that 33% of respondents identified as a sexual orientation other than or in addition to heterosexual. This is higher than the general population in Canada. We have a higher proportion of a gender identity that is not cis. We have an equivalent amount of Indigenous students, higher proportion of people who identify as a visible minority or racialized person, about the equivalent amount of Black students, and we have fewer students with disabilities than you would expect if there were equal opportunity Canada-wide. So if you just look at the numbers of the undergraduate students, we're not doing that bad. But I think if you ask pretty much any undergraduate student, you will know that the challenges that they face, the challenges that any undergraduate faces, or graduate student, or even faculty member, the challenges that they face are strong. There's a lot. Life is hard. Life is really hard. But the challenges that people from marginalized groups face is above and beyond that. And so what I really want to focus on is not so much the numbers, but about the lived experiences and what we can do to help people's lived experiences. And if you think about EDI, so E is equity, that's fair access. D is diversity, right? That's essentially this slide. Are we diverse? Are we representative of the diversity of the population of Canada? But then I is about inclusion, and I is really about, do people feel like they can bring their full selves to work, like they can be authentically who they are and have that be valued? And so that's really the question. I can tell you the answer is no. The answer is absolutely no. So everyone carries some bias, discriminates, whether it's in big ways or small ways. We are taught over the course of our lives to hold certain ideas about particular demographics. And there's no shame or judgment in that. You internalize what you've been exposed to. But I do think it's important to remember that we control how we act. And if we don't pay attention to how we are interfacing with the rest of the world, we can actually act on these biases. And they come out in so many different ways. You see politicians saying really horrible things. But it's not the really horrible things, I think, that are the problem. It's the constant drip of tiny things, of microaggressions that occur over the course of everyday lives. The ability of a politician or a famous person or a person with a lot of power to say something truly horrible is a symptom, I think, of a collective society that allows these little microaggressions or small acts of disinclusion or discrimination to occur. And it's anyone who's marginalized is going to have experienced one or more of these things. I've just put them in to a couple of different categories, but it shows up in so many different ways, where someone doesn't respect you enough to listen to what you have to say. They interrupt you. They don't call you by your title in a formal environment. Sandy can call me Lisa whenever she wants. But I saw a talk one time where there was a man and a woman giving a talk, and they both had the same title. They did the work together, and when someone got up to ask a question, they referred to the man as Dr. So-and-so, and they referred to the woman with her first name. So those kinds of things. Lack of opportunities, lack of acknowledgement, the double standard, all of this boils down to a constant barrage of, you don't belong here, you aren't good enough to be here, you can't succeed here. This is the message. And you'll notice the way it's framed. It's not, we don't want you here, it's you don't belong here. There's no ownership in society in the exclusion. It's about, no, you're the problem. And if you were different, then maybe you'd fit in. Obviously, that's not true. But this constant you're the problem. And you don't belong here. This is the message that gets internalized. And this, I think, is one of the most important things that we need to address. We've started over the last few years counting numbers. I don't know how many surveys I have taken asking me about my demographic information. It makes me really upset when those numbers aren't actually used to create any change, or certainly they're not used to create change that I can see. And so really what I want to talk about is how do we fix how people feel? And so I wrote this paper a few years ago. It's a resource. It's a few years out of date for sure. EDI is a fast moving field, but it does have some really important, useful information in it. And I'm going to go through some ideas. And I want to go through the ideas because when we think about how we fix things, we are not thinking, I don't want us to think about how do we make, a premier or a president an EDI champion. What I want to think about is, what I want you to think about, all of us to think about, is how do we, within our own lives, within our own spheres of influence, make a difference? It's not about changing a law. There are laws that need to be changed, sure, but the people who are in this room right now, we're not going to be the ones to change them. We need to be creating the environment where when those laws are changed, there's support for that, if that makes sense. So this is what I want us to be thinking about. And the first one is to acknowledge our biases and our privilege. We're all biased. It's just, like I said, it's a fact of life. It's an absolute fact of life. If you grow up in a society, and every single one of us has grown up in a society that has biases, it doesn't matter where you grew up, biases may be different. It's human nature. The problem is when we act on them. And most of you have heard of unconscious bias. This is where you have biases that you don't necessarily know you have. And they can be diametrically opposed to your consciously held beliefs. Like, I don't believe that women are any less than men. I believe that that there are strong, successful women. I'm surrounded by them. I like to think of myself as one. And yet sometimes in my head, my knee-jerk reaction is to discriminate. And I have to pay attention to that. Otherwise, I can't change my behavior. And I just fall into this trap of echoing things that I've heard in books and movies and media and on the news. I already said the news, you know what I mean? So we're biased, and it matters because we collectively create a society where truly awful people can thrive. But every single one of us also has power to make a difference. Even if that power is within yourself, you have the power to change how you interact with the world. You have the power to slow down when you talk and think about, how am I using language? Am I always automatically defaulting to he, to him? Or can I take a step back and think they or it, or I'm thinking about a car. Sometimes we refer to it as a he, maybe it's an it, or the driver, it's a they instead of a he, or things like that. Can you change your language? And can you, in changing your language, disrupt your thought processes that default to one particular demographic? Everyone has that power. But then we also have power within our own spheres of influence, within our families, friends, our partners, our lab environments, the committees that we're on. We have the power to change the dynamics in those rooms. And it's not by being dictatorial or being really loud and aggressive. If that's your mode of operation, great, fine. If that's how you want to affect change, great. There are lots of other ways that we can affect change. And so remembering that we have the power to do so is really important. So step 2 is to do your research, listen to your friends and colleagues, and then be vocal. So I would argue that in 2025, can't believe we're in 2025, we've been talking about EDI for a long time now. The Time's Up and Me Too movements really brought EDI to the forefront. There's no way that you can be existing in the world right now, especially in Canada, and use "I didn't know" as an excuse for a behavior. I think we all have a responsibility to understand how we're affecting the world around us. That's my personal view. And so, but also what that means, that doesn't mean that you have to be an expert on everything. I do not expect anyone to be an expert on this stuff. I'm not even an expert, I think, on this stuff. I don't know all of the implications of all of the different ways that humanity is interfaced with one another. And so it's important to be humble and to recognize that everybody is on a journey to better understanding. And so while not knowing is not an excuse, it's also, if it's framed as oh, okay, well, I didn't know, thank you for telling me, I will endeavor to do better, that I think is a really wonderful thing. So having the space and the grace to allow people to learn, to allow ourselves to learn, and to encounter our own biases, I think is a really important thing for any kind of progress. And there's a ton of ways to do that. This is being recorded, and I am more than happy to share my slides afterwards. If there are ideas on here that you're interested in, you can also go to those papers. I'm not going to go through all of the ideas. So number 3 is about being strategic about who you work with. And so there's 2 ways that you can think about this. One is if you are looking for work or looking to join a community, you really want to think about working with people who are going to value who you are. This is especially for the trainees. If you are looking for a graduate position, if you're looking for a postdoc position, I would argue that it is more important to work for somebody who is going to value you as a human than it is to work for somebody who's doing the latest and greatest in a particular kind of research. And so that, I think, is an important consideration. If you are on the hiring side of things, again, there are lots of things that you can do to reduce bias in hiring, starting from how you design the position, making sure that you're really thinking about what the position needs, and making sure that your committee includes diverse viewpoints, advertising the position. We know that people respond differently to wording, to really hard, excellent language. We know that women in particular are more interested in working hard and being part of a community than in being a rising star, or at least they identify more with that language. We know that that when you have the job ad up for reasonable time, and you actually show what your salary scale is going to be, all of those things can actually help people from marginalized groups know that there is a job, and then know that it's going to be something that that they can work with. When you create the shortlist, going through bias training together, making sure that it's representative of the longer list. And then when you interview, being flexible with dates and times, asking ahead of time if there are accommodations. Do you have a food allergy? Do you need a childcare bursary? I guess you can't do that if you're officially hiring, but offering childcare bursaries might help. I take that back. Not for this. Do that for a conference. I'll come back to that later, not for an interview. Having a set list of questions to ask of every candidate, so they all have the opportunity to ask you for the same, or provide you the same information. All of these are things that you can do to help reduce bias in hiring. I'm not going to go too much through restructuring, hiring, retention, and advancement programs, because these are more systems things. But there are absolutely ways that we can think about, especially if you have more power in the university system, if you're in leadership, there are lots of ways that we can restructure hiring, retention, and advancement programs that reduce the bias and discrimination that prevents women from advancing as quickly as people from non-marginalized groups, and even sometimes from men from marginalized groups. Yes, but I'm not going to go through that too much today. It's these last couple that I really want to spend the most time on, and that is number 5 is to generate a code of conduct as a team. So a code of conduct is a shared set of values that you approach working together with, and it thinks about what do we value, what are our cultural norms, what does respect look like, and this is going to be really different for different people, and that's okay. It's not about homogeneity. It's about recognizing or verbalizing for everyone so they can see it, what the norms are. And then how do we interact with one another to make sure that everyone still feels respected, even with these different ways of operating? How do we learn from one another, and how do we deal with issues when they do arise? Because they do arise when you have different people working together with different ways of doing things. You can have issues arise almost always. And the question is, how do we mediate those? And it doesn't have to be a bad thing. If you frame it as a very normal thing, then you can bring the emotion down and actually have very practical conversations about how to work together. Number 6 is to be inclusive. And inclusion is about valuing who people are. So actually saying you are a valued member of this team. If there's an activity that's happening, like for example, we're going to go out to a bar to celebrate something, tell me how I can modify the activity so that you can participate. We'll choose a bar that has mocktails if you're not a drinker. We'll choose a time of day that means that you can participate instead of having to go and pick up your kids. Or here's one, I'll provide a childcare bursary so you can have after school care and you can come with us. Like there are lots of different ways to value someone and to make sure that they can participate in an event. Thanking people for the work that they do. So thank you for volunteering to organize this. Would you please make sure to check if there are any food allergies that need to be considered? So making sure that everyone has the opportunity to participate fully. That's what really being inclusive is about. Being intentional is about knowing that there are barriers. We live in a society that discriminates. And so being intentional is about recognizing in advance, if you can, that there are barriers and then reducing them. So for example, I was just talking to one of my former students last week, and she's quite neurodivergent. And she really struggles being at a poster session. It's loud, it's crowded, people are pushing one another, you can't really hear. And for people with sensory issues, where that kind of noise and that kind of pushing, and it's not even pushing, it's touching. Sometimes it's pushing, it depends on the poster session, can be completely overwhelming. And so she's coming to the end of being in grad school, and she had never been to a poster session where she could last more than 15 minutes. And then the last event that she went to, she actually had her own poster, and she contacted the organizers ahead of time and said, can I have my poster slightly apart from the big hubbub? And they said, yes, of course. And she stood there for the entire 3 hours answering questions about her poster. And so in that particular case, the organizers were not being intentional about recognizing the barriers ahead of time. They were being, I would say they were being inclusive. They responded really, really well to her request and made her feel like she mattered and created an environment where she could thrive. What I would love to see would have been for them to be intentional, where they thought about it ahead of time, and they thought about, there are going to be people here who have sensory issues. Can we have a quiet room? Not everybody wants to go to the bar afterwards. They don't drink, or it's too loud, or they're uncomfortable. Can we have a puzzle room, a jigsaw puzzle room, where people can quietly do jigsaw puzzles and talk to one another, but in a really like low stakes environment? All of these thinking about these kinds of things ahead of time is being intentional. So for example, I have another example here. We know that women are more likely to volunteer before men to do tasks that do not promote their career, to do something that supports the community without furthering their career. And ordering is one of those in a lab setting, taking notes in a committee setting. All of those kinds of things are things that women typically volunteer to do before a man would. And so being intentional as a lab, as the head of a lab, would be to say, okay, look, she's done this for a year. It's now time for someone else to step up. Or she's done this for a year, and I'm going to reward her with an extra career advancement opportunity. Or if you are a woman on a committee and you're not the leader of that committee, don't speak up. When don't volunteer, don't put yourself in that position to be doing more work when there are 15 other men on that committee who they're just as capable of taking notes. They should be just as capable of taking notes. So don't put yourself in that position of taking on the extra work with no compensation or no recognition. Number 8 is about being supportive. So it can be really emotionally draining to be constantly told that you don't belong or constantly feel like you don't belong. And in my experience, all it takes is 1 or 2 people to really see you and tell you that they appreciate you and that you're doing a good job. That makes a world of difference. So being supportive, thanking people for offering ideas, telling them what you value about them. I know you're stressed out about grad school, but remember, it's a journey. It's okay to make mistakes. All of these kinds of things. There's crap going on in the world right now. If you need to talk, my door is open. You don't have to be an expert on anything. You don't have to understand any EDI issues. You don't have to understand everything that's going on in the world. You don't need to know anything. All you need to do is to say, I'm here. If you need to talk, I can listen. And this is about being supportive. And I cannot tell you what a difference it makes. This is something that I discovered 2 years ago, the SPARK method. This is about positivity. It's about reframing where we are and what's happening in a really positive way. This is something I would suggest you check out if I did this instead of New Year's resolutions, and then I made my lab do it, and I really loved it. Number 9 is rethinking the status quo. Just because we've been doing it a particular way does not mean that way is working. It's certainly not working for everyone. And so how can we do things differently? How can we, and it's not even like we're in A, let's go to B. It's about, well, let's move in the direction of B and see how it's working. Some of this is working. Okay, let's sort of move back to A, or let's jump over to C. Like, it's about being flexible. It's about receiving feedback and being willing to change how you do things. Are our practices serving our people? Is there a way that we can do better? These are the questions that we want to ask ourselves. And then number 10 is making action a habit. So there's so many ways. I've just given you a whole list of things that you can do, but really what you need to do is a little bit, a lot. And that is the way to be most effective. So regularly discussing EDI. We've actually started doing it. We've been doing it for a couple of months in my lab meetings. We start every week with a safety question and an EDI question. And the EDI question, both the safety question and the EDI question, the trainees take turns coming up with one, and it's usually a scenario. Let's say this happens, what would you do? And both for the safety question and the EDI question, it's been really, really great conversation. We've gotten to know different perspectives. We've understood, I think, each other more. And I think it's empowered some of the trainees to find their own voice. And I'm so proud of them, but I think this has been really effective and maybe something to try. So regularly discussing it and valuing it. So thank people for bringing things to your attention. I proactively tell people, especially my trainees who have less power than I do, that if I do something, I encourage and I welcome them to tell me about it. And then when they do, I thank them for it because I want to learn. And it can be really hard when you have less power to tell someone with more power that they've done something inappropriate. And it's created opportunity for conversation. And I have learned a lot from my trainees. But then also valuing EDI requires this work, requires, especially if you do a lot of it, it requires a lot of emotional energy. And so creating awards for people who are doing the work, who are doing more concrete work, not just in their own environments, but starting a new club. There's a new LGBTQ in STEM organization here at the University of Alberta that's open to anyone, staff, students, faculty. And so if someone is interested in finding out more about that, they just had, like in March, I think, they had a trivia night at Shakespeare's, and they had to shut down the bar or stop more people from coming in because there were so many people there. They ran out of space. So there's these kinds of things, creating awards for these kinds of things to show that you really value people who are doing something in a more systemic way, I think is important. So just to sort of wrap up, the key thoughts really are to start small. You do not have to change the world. You will change the world, or you contribute to it by starting these things, starting your learning journey, continuing your learning journey, going to a movie with someone, going to an art exhibit with someone that is a artist from a marginalized group. Anything that you can do where you increase your own learning, engage with EDI. These things are really important. So start small, listen and learn, be humble, be patient with yourself and others, be ready to feel uncomfortable, be accountable and hold others accountable for what they say and what they do. And especially in a sort of a work setting, I like to track my progress because it helps me be accountable to myself, but it helps me remember that I am making progress, even when sometimes it feels like it's not very much. We can focus on the negative, and so tracking progress as a way of focusing on the positive is really helpful. So with that, that's really all I wanted to say to start the discussion. I'm happy to answer any questions or continue this conversation. Yeah, and thank you very much for your attention.
Oh, there we go. I could not get off my audio because the host is not allowing participants to unmute themselves. So we're going to have to allow them to unmute if we're going to have questions and answers to the team. So Dr. Willis, thank you very much.
You can call me Lisa.
No, that was pretty funny. That was great. But I'm a first name basis on anybody. That was cute. That was good. But that was fantastic. That really was so informative, and it kind of, for me personally, broadened my concept of EDI, right? It's not just, yeah, it's life. It's us being good citizens, really, right? So that was to me really eye-opening. So so I'm moderating the session, everyone. If you have a question for Lisa, please raise your hand. I'm not on my normal computer, so if I don't see, oh, there's a hand. Okay, I am seeing hands. Please ask Lisa your question.
Hi, Faye.
Hi, Lisa. Thank you for your presentation. Really, really informative. I have a question about track progress or measuring impact. How people often found that difficult because you don't just count the numbers and see you have more women students. It's a success. How do you measure the impact?
Yeah, part of it is deciding what you value. And so for me, when I give a talk like this, I feel like I have made an impact if, someone like Sandy says something like that, if I get questions, if there's been a discussion, for me, that means I've been successful. And so like I keep track of how many talks that I give. So I'm actually wondering if you're thinking about this from the lens of your own personal, how do you keep track of what you're doing? Well, yeah, you are. Okay.
Yeah, like how, let's say, a researcher implements some policies within their group, and they want to see over time how these policies have helped to improve the EDI in their lab, like
Yeah.
how they measure that.
Yeah, you need to embrace, I think, non-quantitative measures. And because you cannot ask your group how they feel. It's not, you can't ask any questions regarding identity or demographics. That's not allowed. And you can't ask them particular questions if you're a supervisor. You're just not allowed. Once they've left, you could, but I still think that would be a bit awkward. I think we need to embrace informal measures of success. So for me, when my students come to talk to me about something that's going on in the world that has upset them, then I know that I'm doing a good job creating a safe environment where they feel like they can be vulnerable. That is not a quantitative measure. That's something that tells me that I'm doing a good job. And that's something, I think, if you're thinking about EDI statements, that is something that you could say that tells you that you're doing a good job. And I think that is a valid outcome, or a valid measurable, even though it's not quantitative.
Yeah, totally. Thank you very much, Lisa.
Please raise your hand if you have any questions. Oh, I see one in the chat. Alana, would you like to ask a question, or would you like me to read it?
Oh, sure, I can. Yeah, thank
Yeah.
you. Thank you very much, Lisa. I really loved your passion. So that's very nice to see. So I have a question. How do you feel about asking your team to complete an unconscious bias survey or questionnaire and repeat it over time? Because I've done it, and I was surprised of how things change over time if you have intentions to change things.
I think that's a good question. I'm wondering if as a supervisor you can require that. I'm not sure that you can require it, but I'm not also sure that you can't require it. I am sure that you can't, it must be private, and you can't ask for feedback on it. You can't get anything out of it. But to ask them to do it, even if you just asked, I think would be okay. There are nuances to that. So when you ask people to do unconscious bias training, it depends partly on the training. If the training is simply pointing out problems, the people who are already marginalized already know a lot of those problems. Not if they're young, like young, maybe in this day and age, young people know more about it, but I think young people don't know the extent to which discrimination shapes their lives as much as they do once they get a bit older. So they might know a little bit. So taking an unconscious bias training that talks about how people are marginalized and how you have biases against particular groups can actually harm those groups more and be water off a duck's back to people who don't already buy in. Do you know what I mean? So requiring the training in and of itself is not sufficient to change a culture. I think it's a good idea as one pillar of a program to learn more, but it needs to be supplemented with conversation so that people understand better what the implications of a particular policy are, or unconscious bias. Does that make sense?
Yeah, it's complicated, so it's not. But thank you.
Yeah, it is.
Thank you.
So I'm part of an organization, a national organization, and It's kind of a funding organization, and we implemented unconscious bias training for everyone. If you get funding from this organization, you must take the unconscious bias training, and it is checked. And I think it has made a bit of a difference in terms of we now have a shared vocabulary to talk about things, but it has been insufficient to get people to the point where they're writing really good EDI statements, or it's not been sufficient to actually translate into changing behavior. I guess that's the key point, is what you want to see is the change in behavior. And in and of itself, I don't think it's been successful.
Other questions? While people are waiting or thinking, you brought it up at the beginning, but I actually have that. So EDI, DEI in the States prior to this year, but now we're ACB, Accessibility, Community, and Belonging. Help me with that. Should we using those terminologies now? Is it just terminology, or yeah? Could you help me with the ACB change and the whys, and how should we be like articulating as we think about EDI within our own atmosphere?
Yeah, it's a really good question. Language does matter. It matters a lot, and I am fully supportive of our particular situation, having the vice provost EDI, now the vice provost ACB. So this is access, community, and belonging, for those of you who don't know what ACB stands for. The political climate in Alberta and the extent to which the provincial government is involved in the operations of the University of Alberta means that continuing to use polarizing language is not productive, and in fact could be counterproductive. And for me, it's not about what we call it, it's about whether or not the work gets done. And I know that in this case, the change in language meant that the work could still be done. In other places, like the University of Calgary, instead of vice provost EDI, it's now associate vice president EDI. And so instead of maintaining her own portfolio underneath the provost, she's now an associate VP in the Office of Research. So that was a very different strategy. And I think I like our strategy better. The research services office here, the VPRI, still uses EDI, because EDI is what the federal government uses. EDI is what's recognized across Canada and beyond. And so there is still EDI here at the university. EDI committees were offered the opportunity. Did they want to change, or did they not want to change? And I think most of them decided they wanted to keep it EDI because they were attached to those words, to that language. And fair enough. I would rather be effective than right. So if being effective requires, so I remember I was working for the federal government when we changed from global warming to climate change. And that was in direct response to the Bush government and the polarizing nature of global warming. And that's not to say climate change is not polarizing. It wasn't polarizing for a long time. It's now become a little more political, a lot more political than it was. But that's the language that was needed to get the work done. So for me, I am completely fine with the name change. What we need is the accountability to making sure that progress still happens, that making sure that that doesn't mean that that office is underfunded, or that she has lost her ability to do the mandate that she was originally given. And I don't think her mandate has changed at all. So that's my perspective on ACB.
Thank you. That helps me, so thank you. Any other questions for Lisa? If not, I really would like to thank you again, Lisa, for maybe teaching many of us, some are reminding people, but it is about that small steps and in continual learning for all of us. So really appreciate you presenting to all of us today. I thank you to all of you who are online that have joined us. Those who are registered will get an email in the next few days with a link to the video, and you'll also be able to find it under the events section of WCHRI's website. I'd like to give a special shout out to Beth and Kingsley, who is putting together the seminar series for WCHRI. Really appreciate it. This is a series. You will see other advertisements for future webinars coming up. And again, thank you to everyone, and enjoy the nice weather out there today. Take care. See you all later. Bye.